A patient in his 9th decade of life with a complex history of surgery and radiation for pharyngeal cancer returns with biopsy-proven recurrence. He is to undergo excision using a CO2 laser. He is known to be an extremely difficult intubation, but in order to remove the tracheal tube from the field, the procedure is performed using Thrive airway management. During the periods of laser use, an oxygen blender is used to reduce the FiO₂ to 21%. Periodic pharyngeal toilet is performed using a flexible scope.